start on this computer here. All right. Well, good afternoon. So we are recording this webinar for you guys. I am so excited that you are here. I'm going to open the chat box because I want this, even though we are virtually having to communicate, I definitely want this to be an interactive session for all of us. I know that many of you may have seen my presentations if you got to come to Leading Age Oklahoma, the conference. Wow, was that not the greatest and the last for many of us, unfortunately. And so I had a great time with you guys and hanging out and learning a bunch of great tools and techniques. I hope you're able to take those back and implement them in your communities and in your building. And so today I asked Lisa and those at Leading Age with Mary and everyone if I could do some webinars for you all to help you understand what is COVID doing with the impact of activities. So what is the plan and how do we continue to take care of our residents? And this is extremely difficult. So I'm going to give you a little background on myself. So I am an occupational therapist. I've been a therapist for over 10 years now. I have been everything from a rehab director to an OTR to I've been a director of rehab, a regional. So I traveled across multiple communities for a while. And then I landed and was a activity director here at the building I'm in currently for several months. And they asked if I wanted to go to administrator school. So I went and got my administrator license. And so now I'm the healthcare administrator at a nursing home facility. We have a 100-bed unit with dementia care. And so we take care of adults with dementia. We also have an adult day program. So I know many of you were saying you're from an adult day center. So I know how that feels as well during COVID. So I've got a lot of great tips and tricks. I've worked a lot in independent living, assisted living. So I have a wide range of experience. And today I want to help you understand what is going to be the best way for us to make it through this together. I think we as engagement, life enrichment professionals, we have a special place and it really is our time to shine. However, we do not want to take steps backward. We want to continue to push forward, making good improvements and ensuring that our residents get to live life, not just live by the restrictions that are put on us by regulation. So we're going to talk about how we can safely continue engaging and continue thinking outside the box, but keeping everyone very safe. So we're going to win this war. Okay, we're going to win the war. I've got my cape on today, so I wore it for everybody for us to feel like superheroes. I know that every day I wake up in the morning and I think, oh, is COVID gone yet? Right? That's a common thing for all of us. I follow social media and everybody is ready for this to be over. However, we do have to be ready for our new normal. Okay, so unfortunately, I'm not here to say that COVID's leaving anytime soon. I wish I could bring that information to you and say, hey, by the way, it's going to be gone in a month, but it's not. This is our new normal. I think the most difficult part is hopefully over. I think we have a pretty good handle on what this is going to look like. I know CMS and all of our state regulatory agencies are working diligently at trying to figure out how to protect our senior population the best. And I am hoping and praying, and we're very active in organizations like Leading Age Oklahoma. We're very active in our state agencies as well, trying to say, hey, here's what we recommend. Here's what we want to see. Here's how you can better take care of us, because we need that voice right now to make sure that those who are sitting in their offices trying to keep everybody safe, it's actually they're hearing from us and hearing what we need and what our seniors need. And so our new normal, what is that going to look like? All right, we're going to talk a lot about that in this webinar. So what changes have you seen in your personal life? Okay, not your work life. Okay, I know there's a lot of changes in the community, but I want to hear what changes have you had in your life? Again, I want you to use the chat box, and I will tell you that I have a giveaway at the end. I will tally up everybody's comments and see who commented and interacted the most, but I have a giveaway and I have a picture of it at the very end slide. So you are going to want it. So if you will interact and make comments. So what changes have you seen in your personal life? Okay, what have you seen? The freedom to leave and go out whenever I want, right? No beauty shops, no grocery stores. Yes, I've got box color on my hair, by the way. It's that 28 washes, it works, okay? Yeah, no beauty shop. Kids not going to school. Oh my goodness. Yeah, that's a big one. Frowning face. That's good. Yeah. So there's a lot of changes for us, right? I mean, there's things that have happened in our communities. They're saying our homes seem more peaceful. Okay. Not getting to go out to eat. I know those of us who don't like to cook, man, that's difficult. Luckily, I have my husband at home cooking. That's a good thing. Masking and social distancing. Yeah, if you're a social person, this is really taking a toll on people. Life changes. So some good, some not, right? So many restrictions. And wearing our mask every day. I know that is, I go out to the grocery store even now, and those who are not in healthcare, it's like, why are you not wearing a mask? I think that people just don't understand the importance of wearing a mask and protecting other people from you. Yeah, no hugging. I know that's probably the hardest part. So yeah, great. Thank y'all for interacting. So great insight into how we've had our lives personally changed. Things from, going to church on Sundays. There was a lot of days that, for a month or two there, we were having to do sermons on video conference, okay, not getting to go out to eat, only being able to do takeout. We couldn't go into restaurants. I mean, there's been a lot of personal impact. However, are you still eating? Right? We're not resisting the change. Okay. We had the choice in the beginning. Could we resist? Okay. So that they're saying, hey, don't go out to restaurants. Don't, you can't go get your hair done. We could have resisted the change and shut down and became very depressed and upset and just closed up. However, many of you, I imagine, have adapted. Okay. We've learned how to shop online. We've learned how to go do pickup. We've learned that, our favorite restaurants, we can go pick up our meal and take it home. We've learned how to cook at home. So we've done things and adapted to the new environment. Okay. It's our new normal. And some of the things that have come out of it have been extremely positive. It's like, wow, this is great. It's good to be aware. I love going into the grocery store now and them cleaning my basket before I put my hands on it. Okay. It's like, wow, everybody is so aware of all these germs that we've just been picking up for so long. And so we've adapted. Okay. We're not resisting. We've adapted. We have to do the same thing in our jobs, okay, in our nursing homes, with our seniors. We have to help them not resist the change, not be negatively impacted by the change, but adapt. We've got to adapt. So let's talk about some pre-COVID goals, all right? So we talked a lot about these if you were in the sessions in the conference, at Leading Age Oklahoma Conference. If you were there with us, we talked heavily about programming, about areas of wellness. Okay, we want to help our residents, like I said earlier, we want to help them live life. Okay, not just exist, not just be, not just fit in our little bubble and on our schedules, but we want them to live their life, okay, for them. And looking at their areas of wellness. That is the most important piece for activities to do, is how am I meeting these areas of wellness? So you've got physical, emotional, intellectual, spiritual, social, okay, and as well as environmental. Environmental is huge when you're working with our senior population, especially those who have dementia. Before COVID, we were really concerned about safety and health, right? It wasn't just because COVID's happened that all of a sudden activity professionals are thinking about safety and health. We thought about these things before, maybe not intentionally thinking, how am I going to keep them safe? But we would. You don't leave scissors out. You don't leave knives out after you cut a cake. You ensure that you're taking a nurse or an aide, or you have stuff to do CPR if you're on an outing. You know how to keep them safe whenever it's just you and not your nursing staff. You ensure that you clean things. I mean, we had safety before COVID, okay? We had our SDS sheets. I mean, there's a ton of safety and health that we have done for our residents. So this was all pre-COVID, right? These are our goals for pre-COVID. So what are our goals now? Okay, what is our post-COVID goals? Well, they're the same, right? So you see the slide, it's just the post part. We still have the same goals. We still have to continue to think, I've got to meet my residents' areas of wellness. And you know what? We're not going to resist the change. We're going to adapt and figure out, okay, it's going to look a lot different. Okay, maybe not a lot, but it's going to look different than what I did before. So how am I, as the activity professional, how am I going to adapt and change in order to help my seniors adapt and change, not become just depressed or resistive, and continue to meet their areas of wellness? So it's not the what we're going to do, it's the how we're going to do it. Okay, so there's nothing changed in what we're doing. It's how we're going to get there. And so I'm going to help you today. I hope I give you tons of ideas by the end of this on how you are going to be able to help your residents continue to meet their areas of wellness. So here's a few changes. So as I'm reading and going through these, I want you to tell me what changes you've specifically seen in your community that have impacted your residents. Okay, so tell me what changes you've seen. All right, so go ahead and start typing in the chat box. So I'm going to go over these. So activity structures. Okay, we're going to talk in depth on each one of these. We've seen different activity structures. Okay, more one-on-ones, more hallways, small groups. Some of us, even I've seen on social media, unfortunately, that some places are saying that activity professionals weren't essential healthcare workers. Don't even get me started on that. Okay, that just really upsets me. I want to give you a little background real quick while y'all are typing in y'all's changes. I want to tell you what's happened in my building. We actually got COVID. So I was at leading age with you all. I came back, my CEO actually called me. I was in the hotel there with y'all whenever we were doing the conference, and she said, hey, I really think this COVID stuff is serious. Like, we're going to have to look into some policies. This is going to get pretty serious pretty quick. And sure enough, we got back that next week, and it's like, wow, this whole new world. Okay, we literally stepped out of conference, and we walked into a very different world in long-term care. And so we had, I guess it was a couple weeks after conference, we had a terrible GI bug in my building. And my DON and I kept saying, my gosh, what is this GI bug? And it was right as some of the research came out saying that COVID could present in seniors as a GI problem. And so I was screaming at the top of my lungs to everybody that would listen, I need you to test my residents for COVID, test my residents for COVID, test my residents for COVID. And nobody would listen, right? Everybody's panicking. The health department's panicking. HHS is panicking. The hospitals are panicking. It was crisis mode for sure. And I'm sitting there saying, hey, I think we've got this. And I kept telling my DO, I think we've got this in the building. I think we have this in the building. And sure enough, like 2 weeks after the GI had started, we tested one resident. My medical director's like, we just need to test in a private lab. And sure enough, we had COVID. I had 11 cases of COVID on, thank the Lord, one unit. We tested over 30 staff at that time, and I had only 2. We definitely had seen God move in our building and protect us like you would not believe. But we have had COVID. Today, we just had a huge celebration with music and everything, balloons and you name it. You activity professionals have been proud of me. We had a huge celebration as we brought all of our guys back from our COVID positive unit today. So we are officially COVID free at my building. So I know how this feels. Okay, there's a lot of changes that have happened because of this, but you cannot just shut down. Okay, we have to find processes. And so my whole point to the story was I had our regulatory came into the building, and when she came in and did her rounds, the first question was, well, not first question, but one of her questions as we were making rounds is, hey, do you still have activities in the building? And I said, yes, ma'am. And she said, do you feel like that's an essential? I said, absolutely. And let me tell you why. And I gave her an entire earful on why I felt like activities were incredibly important right now, especially with the way that they have cut out all of our family visitors. And we're going to talk about that. So we're essential. Okay. So you might be doing one-on-ones, you might be doing hallway, you may be doing small groups. If you're an adult day, you may have shut down. Okay, your adult day, if you're still open, may look very different. So a lot of changes. Outside vendors and entertainers no longer here. Okay, volunteers no longer coming in the building. Family visitations, okay, cut completely. No family visitations unless they're imminent, okay, at the end of their life. And then a lot of virtual technology. So let's see what you guys have seen. Yep, a lot of small groups, one-on-one, no family visits, so very similar. Social distancing, yes, and we're all dementia care, so you can imagine how difficult that has been. In-house television, using our vendors for programming, good, that's awesome. One-on-one, small groups, 6 feet apart, hallways, yes. Window visits, I'm glad y'all are doing window visits. No communal dining, no outings. I know. I tell my team that all the time. You know, our residents, it's so hard because they can't see their families and they don't get to go home like we do. So we get to leave the building and go home, but they do not get to leave the building and go home. So that has been a huge change for our seniors. And so let's talk about each one of these. So thank y'all for answering and typing in there. The first thing we have to think about, okay, and we talked about this actually at conference, which is surprising, is infection control. Okay, we talked about you have to understand regulations that are outside of activities. You know, we all know what kind of CEUs we need. We all know what, you know, degrees or schooling we need in order to work in a community. We know those. Okay, we know resident rights and you know, what the guidelines are for activities, but we need to also understand the infection control piece of it. All right, we talked a lot about SDS sheets and when we're using them for aromatherapy. Well, now we need to know a lot about infection control, what we can clean with, how we should clean, how long the solution should sit on the surface before we wipe it off. And those things are really important. It's not about just wiping things down. It's about really understanding the chemicals that we're supposed to be using right now. So throughout this entire presentation, I want to make sure I'm clear. I want you to follow your company guidelines. Okay, as the administrator, I would hate for someone to come in my building and say, hey, I learned this on a webinar, therefore I'm doing it. Not saying it hasn't ever happened before, because it has, but I would hate for you to go back and say, well, Bailey said. So you want to follow your company guidelines first and foremost, okay, on anything, whether it's hallway activities or infection control, anything that your building is saying, you've got to follow your company guidelines, because if you're not following your policy, then you could end up getting your building in trouble, and we do not want that to happen. So cleaning, all supplies. All right, when that GI bug hit, I'm telling you, activities was the first thing I looked at, because we traveled between houses, okay, between hallways, if you're in a traditional building. So we were traveling. I was like, how are y'all cleaning the supplies that you're using, right? Because all hands go on the supplies that we use, whether it's color pencils or balls or whatever we're using to engage. Most of the time, a lot of people are touching them. And so what is our process on cleaning? So now we've got to think, okay, what can we use? What surfaces can we clean? What surfaces does COVID live on? And how are we going to adapt and modify those activities? We've got to encourage masks. Okay, even in dementia care, we are encouraging masks. I'm telling you, they come right off and we just document, hey, they're not wearing them or not wanting to wear them, but you have to show that you're trying. So even in activities, you have to show that you're trying. Washing hands. We're a great team member to help with washing residents' hands before meals. So we implemented this in the beginning when we knew we had COVID, but nobody else would listen or test. We implemented hand washing at every meal. So we had it consistently at lunch with the activity team, but then we also implemented it and in-serviced the CNAs on you must, okay? We say we do, but you must show that we are washing hands at breakfast, lunch, and dinner, okay? Because if they're wheeling around, okay, and touching the wheels or touching the tables or the bottoms of the tables, they're gonna be passing on germs. So we were very diligent at washing hands, and activities is a great team member to help with that. And then also not touching their face, okay, encouraging the residents to not touch their face. The medical director that we're working with the health department here in Fort Worth, Texas, she kept saying, you know, your face, this is where it's going to enter, your mouth, your nose, your eyes, keep your hands off. And so I implemented quickly, we have N95s, because of great donations. We have a ton of N95s in our building right now. With all of our positive COVIDs, we really needed them. So we had N95s, and I offered for the staff to bring their own eye protection, so just the safety goggles and glasses. And I told my staff up front, hey, whatever you need to do to make yourself feel safe, as long as it's within regulation, and you know, I'm good with it. If you have a different mask, an N95 that you want to wear, we'll work with it. But I want the team to feel protected. We want the residents as well to feel protected. Modifying activities so that the residents don't touch the same thing. Okay, we have to modify, and we maybe not touching it, but using our feet instead. So if, like, for instance, an easy one is ball toss, okay, to get people engaged, or balloon volleyball, or whatever you may be playing with your hands, we've got to modify it and not use our hands as much right now, but use our feet. So we're going to talk about how we'll modify. But infection control, okay, we think, oh, that's a nursing, you know, function. It's not. It's us too. Okay. If you used to have in therapy, and I know many activity professionals that I went and consulted with have the rice and the beans in the buckets, those are great, except you've got to think about how you're going to clean the beans. How are you going to clean the rice? Those things you can't clean in order to reuse. So you're sticking residents' hands in every time. And if I wipe my nose and stick my hand in and the next person sticks theirs in, then I've just contaminated. So you got to really think through this. And it's not just, hey, it's a great activity, but how am I spreading germs using this activity? So activity structure. All right, so this is one of the first things that they changed, okay, is one-on-ones, hallways, and small groups. Many of you are saying you're doing hallways, many of you are saying you're doing one-on-ones and small groups. Probably a good mix of both is acceptable. I know that in our building, we have got dementia care, okay, and many of you I know have the same thing, and you can't just tell a resident you must stay in your room. You can't block them in their room. You can't tie them down. They still have rights, okay? I did have a surveyor tell me that resident rights are out the window when COVID hit. And I'm like, I don't think so. Okay. That's not okay. They're not out the window. They still have rights and we will still honor their rights. And so we have to be realistic. All right. You have to be realistic. If it's just you and an assistant and you've got a 400-bed facility, I hope it's not that big with just two, but if it is, you have to be realistic. You're not going to get one-on-ones with every one of your residents. That's not possible. And you can show that it's not possible, but that's not possible. We have to be realistic with the things that we're given, including our time. And we have to modify our activities. Okay, we've got to modify them. And we're going to walk through how to modify. And I've got a ton of free resources too that you'll be able to download. We've got to change our mindset from group activities. A lot of us, and I found this even before COVID, is many of us felt really comfortable with small groups, okay, or big groups. We felt comfortable with those groups. But when it came to like one-on-ones or individuals, it was like, okay, I don't really know what to do with them. Okay, I can do the fun parties and the games, but when it comes down to the one-on-ones and more person-centered, it's a little more difficult, okay? So we have to change our mindset. There is a document on my website that I actually hired a girl to assist me whenever COVID hit because I was seeing that activity professionals were needing a lot of resources and I did not have time to make them myself. So I have a girl that assists me, and then we made this survival guide. And so in the survival guide, let's talk about one-on-ones first. So in the survival guide, there is a list. This is the list of activity apps, and you can download all the resources are free. None of them cost anything, but you can get on and download this guide. And there's a ton of apps in that guide. And so if you have technology, and I know many of you probably are looking at getting technology, and we'll talk about there's some CMP money out right now that you can apply for if you have Medicare and Medicaid services. But these apps are fantastic, all right? And a lot of your families are going to be willing to buy tablets right now because they want to connect with their loved ones that are in your building. And so getting these apps to be able to have something to do with your individuals, or if you have an app in the building that you could take around and complete your one-on-ones, you just want to make sure you're cleaning it appropriately. All right. So download this list. Okay. There's Candy Crush that we all love. There's Tai Chi exercises. There's Train Your Brain. Okay. Wheel of Fortune type activities on it. So a lot of one-on-one activities that you can do. If you're doing one-on-ones, I would encourage you to give your assistants a guide. So if you're the director and you're not actually going to do your one-on-ones, or you're having, your CNAs are assisting you in one-on-ones or doing activities, you want to make sure you kind of give them a guide on what to do when you're in there. So it's not just intellectual, okay? Because we have to meet the 5 areas of wellness. So if every time I go in there, I just have a 15-minute conversation with Mr. Smith, I'm not accomplishing much. Okay, it's probably just an intellectual activity. But if I say, hey, on Monday when you go see Mr. Smith, I want you to do some exercises. On Wednesday when you go see him, you and him are going to play a trivia game off of one of these apps. And then on Friday, I want you to set him up and let him watch his church service that he enjoys. Okay, so then you've met 3 areas of wellness in the week during your one-on-ones that are short one-on-one visits. But if we don't give guidance and get ourselves organized, all right, and know our purpose, then we're just going to be walking around feeling like we're just going in a circle, all right, with no direction. So we've got to have direction. With room isolation, okay, and hallway activities, there's a lot of things you can do, right? There's a lot. Whenever I first started, I follow a lot of social media groups that have thousands of activity people. And I told my assistant, I said, oh my gosh, like everybody's thinking bingo, hallway bingo, hallway bingo, hallway bingo. That's the one thing I could see, hallway bingo and these carts, okay? Everybody has the fancy carts. Those are fantastic, right? Those are fantastic, great ideas. However, this is our new normal. Okay, if I was a senior, I don't want to play bingo in the hallway every day. I'm sorry, but I just don't. And, I love your margarita cart, but, I'm missing my family. I'm missing socializing. Okay, I'm missing going to church. I'm missing, exercising. Okay, I'm gaining weight. Many of us have gained weight because of COVID. Like, there's other areas that our seniors need us to focus on. So with your hallway activities, we're just going to look at how we can adapt them to make them safe. Okay, so we're just adapting. You can do car races, right? We talked about car races at conference and how we have the remote control cars that can go around, and you can have the balloons on them and do target practice. Those are all still activities that you can do if everybody's sitting in their doorway. Okay, they can look down the way. If you want to do a fashion show and have your residents all dress up, get your aides involved and say, hey, today's our fashion show. It's going to be a, quarantine hair fashion show day. And everybody, do crazy things with their hair and step out and show everybody their hair as a fashion show, and you're making announcements. That is perfectly fine. Okay, that's a social activity that you can do. Name that tune. Okay, playing music down the hallway and listening for the first person to yell out the tune, taking a whiteboard, writing, blanks on it and doing hangman up and down the hallway. These are all very doable. They just have to take a little bit of planning, which you got to plan them anyway, even if you're doing them in a small group or a large group. So you can still do them. You just have to think, how can I adapt, okay, these activities in order to make them appropriate for the hallway? Okay, doing a art project show. Okay, that's something that we have done, is a lot of art. Okay, our residents love to express themselves through art. Traveling. Okay, you can, again, these hallway activities, these are in the survival guide. So if you want to download that, you can see all of these suggestions. If you want to type in some fun activities that you've done in the hallway, that would be awesome. But they're available to you. Okay, and almost anything that we have done in small groups can be done in the hallway. Okay, I would imagine that if you gave me an activity to adapt, I could probably adapt it and make it a hallway activity that's safe for individuals to do. We have to remember, we cannot just sit down and say, well, wait till regulations tells us what to do. We've got to continue moving forward. And this is one way to do it. Say, hey, I'm being safe. Okay, we're still doing wood shop. We're still building our American flags. Okay, now I have everybody with their own piece of wood and everybody with their own sander or sandpaper, and we're sanding individually, okay, up and down the hallways. That's still doable. All right, don't get scared and just try to do just one-on-ones or limit your activities in the hallway to something like a bingo or reading stories or just intellectual activities. For small groups, the things that you want to remember, we're used to doing small groups. This is pre-COVID, okay? We did this before COVID. We know how to do groups. The things that you want to just be aware of, again, is those infection control. All right, infection control, infection control. Your nurses will appreciate you, okay? If you sat in, so if my activity people sat in morning meeting and they weren't very clear on, how to wash or clean something, and they actually asked, and said, hey, housekeeping supervisor, can you tell me what solutions that you're using? I, as the administrator, we have a contract, a housekeeping people, and I had to ask him, hey, I need those papers on the solutions that you guys are using to clean the equipment, because I'm not an expert in cleaning solutions. Okay, that's usually our housekeeping supervisor that does that. If I was an expert in everything, that's why I have a good team. So as the activity professional, we don't expect you to be great at knowing what solutions to use and clean your items with. So we have to educate one another. It's okay to ask, hey, I'm going to use this tool for my activity. How do you suggest me clean it? What supplies would you give me so that I can make sure that we're cleaning and disinfecting this? So small groups, 5 to 9, okay, no more than 10 is kind of what they're recommending. Your, again, community may have different requirements, but small groups. Okay, keep them small. If your residents will wear masks, please wear masks. I have to tell you, I have gotten on to many team members for taking their mask down to talk to a resident and putting it back up. That is not the purpose of the mask. Okay, and I have preached this to my team, and I'm going to preach this to you. Wear your mask. Okay, the mask is to protect your residents from us. We told our staff early in the beginning of this that our residents had been quarantined for a while from nobody. When we stopped visitors coming out, all of our vendors, at that point, it wasn't our residents giving it to our staff. It was our staff giving it to our residents. We have to be diligent at wearing our mask. I made a YouTube video about how to communicate wearing a mask. All right, that's how passionate I am about making sure you keep it on. All right, and I'll give you all of the tools and videos you can go watch at the end. So you'll have all those resources, but wear your mask. Don't remove your mask, okay? Don't touch your eyes. Don't sneeze in your hand and touch surfaces. You don't know if you've picked it up at the gas station or the grocery store. So protect our seniors. Have them wear masks if they will. Social distancing, okay? Keep them 6 feet apart. We have cameras in our building, and so we stopped all of management from going house to house in order to decrease the traffic. And so I was watching the cameras in the morning, just ensuring that we're following all of our processes. And sure enough, Activities has a small group. It's small, but we're all sitting next to each other, okay? And not okay. It's not okay. You cannot have the residents sitting next to each other. And so this is where the environment piece of our wellness comes in. As the activity professional, you can walk around and say, hey, I need to move this chair, these 2 chairs 6 feet apart in order for when my residents come out and they're going to try to find a place to sit, that they don't just sit next to each other because it's convenient. They're not going to move the chair. We have to move the chair. So environment. So with activities, same thing. Set your stage up, set the environment up to practice the social distancing. That's what's going to help us ensure that we're keeping them separated. With dementia care, okay, I'm telling you right now, you just have to redirect. All right, you just literally have to redirect. And we have been incredibly blessed that, our staff, again, have got to leave on their mask, because if it comes in, it's coming in from a team member. And so with them, environment is key. And I've told my families this. So we started a Zoom call when this all began, and we knew we were shutting everything down. I started a Zoom call just like this with all of our families. If you and your building have not done video conferencing with your families and you're having complaints in your building, I would encourage you to tell your administrator. They are more than welcome to reach out to me to figure out how to use Zoom. Okay, you can use it for free for 40 minutes with groups of 100. Use technology. Okay, we started our call. I get on, I tell them all my processes that I'm putting into place. I'm telling them what staff I have in. I'm telling them any COVID tests that we've done. And I did this before COVID. Okay, so if you don't have any COVID cases, now's the time to start them. Okay, even if you have them, you need to do it. But even if you don't have COVID cases, start these calls. And so I do calls with them once a week usually, and they can see me. Just like you can see me. They can see me, they can hear me, they know my struggles. There was one day that I did break down and cry because it's emotional, okay? And I had chat boxes coming in like, we love you, and thank you for supporting. It's nice to see that you're human. It's nice to see how much compassion you have for our residents. Start doing calls with your families, okay? Let them hear your voices and let them know that, hey, we're doing all we can to get you back in here. I actually have one scheduled this afternoon with all of my families, as well as one with all of my staff. And so dementia care is difficult, but you've got to just communicate, okay, with your families, with your team, what you're doing to protect them. You cannot restrain them. So if you get it, it's one of those things, you just have to keep it out as best you can. They need to know you're doing all that you can. So your outside vendors and entertainers, this was a huge loss, right? I mean, my guys loved Elvis coming in. The ladies really loved it, but they loved Elvis coming in. We have an Elvis impersonator that comes in and does singing like at least once a month. Okay, they loved that. They missed that, but we don't have to miss it. Okay, we can just adapt and modify. So beauty shop, for instance, we cannot do beauty shop. I don't know if you guys have closed yours down. I imagine that you have, because CMS did tell us all to shut down those services. We asked a staff member in our community and wrote a policy and infection control and how we were going to maintain it, but you know, after 2 months of no beauty shop, our guys were starting to really need a haircut. Okay. Our ladies really needed a perm and a color, and it makes them feel better. Okay. Beauty shop makes them feel better. It's part of that quality of life. And so I asked if our staff had a license, and I did. I had one CNA that has a license, and man, she has rocked it. Okay. She hasn't done it in a while, but you know what? It's better than what we had before. And so she's done a great job. So if you have staff in the building, talk to your administrator and see if that's something that you can write a policy on and they feel comfortable having your team member cut hair. We offered her a little bit extra than her wage, and you know, we came to an agreement, and it works really well. My activity team helps her with knowing what the residents, you know, hair needs to look like on houses that she hasn't worked, and it's working out beautifully. Virtual volunteerism. Oh my gosh, this is just blown up. Okay, virtual volunteers has just exploded because people are at home and they now have access to volunteer. Those who wanted to volunteer, they have extra time. We even have used students, right? We had a huge student program before COVID that they would come in and do clinicals, and then they all got, you know, shut down and the schools stopped. There's kids at home. We have done a ton of virtual conferences with families and babies and, you know, the nursing students at the university. We called them and said, hey, could you do some activities? Our Dementia Friendly Fort Worth, who's an organization here, they have started having their RN students from a TCU, or one of our colleges here. They've started doing Tuesdays. They do a craft activity. And so they each take turns. One Tuesday, they prepare a craft and do a live Zoom for 30 minutes. Great. Okay, our students know how to use technology. They love to talk to seniors. Okay, it's fun. So have them say, hey, every Tuesday at 10:30 to 11, could you come up with a craft, or can your students come up with a craft to get their hours that they need as a student? So volunteer using it virtually is possible. Okay, they can't come in and do visits like they did, but they can still do things virtually. You may even have them, and we'll talk some more about volunteering in a minute, but using your students. There's a ton of free resources right now, a ton. On YouTube, if you get on, like, there's some, like the circus thing that they do, like at Six Flags, they have all of those recorded. I mean, I'm telling you, there's a ton of zoos are doing educational stuff for people that you can go on and watch. There's music therapists that are posting music therapy sessions that you can do. There's drum circles that you could engage in. So there's a ton of things that are coming out. People are giving activity packets out like crazy. So using your resources that we have now, whether it's entertainers or our vendors, having your entertainers, even like Elvis, we asked him, hey, can I still pay you maybe a lower rate, but can I pay you and you record a session so I can play it for my residents, and they can watch it in their rooms, or as we do small groups, can we have you record those? So don't just let them watch though. Okay, that's one thing that I want to highly encourage you to not do. Is it's easy for us right now to say, here, take this iPad, here, watch this TV screen while I go do all my documentation I have to get done. You watch this and I'm going to count it as, you know, this area of wellness. We can't just watch. Okay, it's not just time to just set them up and let them engage with a screen. We have to let them engage as well. So let's say it's a music therapy session. Get some of the egg shakers and have them doing egg shaking while the person's doing, you know, their thing on video. If it's exercise, make sure they're engaging in the exercise, not just watching the exercise. Asking questions. If it's a movie or something that you're watching, there's a ton of educational. I mean, how this was made, and this picture here, let me minimize that so y'all can see it. This is in the survival guide. So the survival guide that I told you was free on the website. This is a huge list. I told my husband, I said, you need to get on YouTube and find channels that are appropriate for seniors. We haven't watched every single show that they have put on there, but there are a ton of YouTube channels that are appropriate for seniors. There are pages and pages of appropriate YouTube channels for various things like farming and gardening and crafting and wood shop. And I'm telling you, there's a ton of them in that resource guide. So download those, have them watch them, but have them interact. So if it's a craft that they're doing, making jewelry, get the supplies ahead of time and allow them to engage in the activity to do the craft. Okay, so volunteers, let's go back to this. So virtual volunteering. If they could put together packets for you, all right, there are packets, we call them weekly wellness packets, or the weekly compass. I'm going to show you one real quick. So you should hopefully be able to see my weekly compass. If you can, will somebody put in the chat box a yes, so I know. So the weekly compass, thank you. The weekly compass, I got Casey, my assistant, to help work on this. I wanted a packet that y'all could download one time and have multiple areas of wellness that you could meet, especially whenever we were really shut down with no groups. So it goes through intellectual, physical, spiritual, emotional, and social. So there's trivia, there's anagrams, word searches, all of this is cognitive. You see a lot of this being offered right now. There's coloring sheets. These, however, are pictures that you can use to engage residents, print them out with on cardstock and color, and you could have conversations and reminiscing, talking about what it feels like to walk through grass or walk through even whenever it's like, has dew on it in the mornings, what it smells like. So there's pictures that go with the theme. All of them have themes. There's actual questions that you can ask based off of the theme. There's crafts. This is an old one. This is a coffee filter flower. So there's a craft idea with all the supplies. Here's all the answers. Let me get down. So there's another baking theme included with this packet. Let me get down here and I'll show you some of the other areas. So recipes that you can make. Love that. Sudoku. Learning something new. Okay, we talked about this at conference. It's really important with dementia care for individuals to continue to learn. And so learning a new language, okay, it has the picture there, has the English word and the French word, how to say it. So English, German. There's social, okay, so getting how can you meet your residents' social needs? So writing a loved one a letter, okay, and telling them what you like most about them. Have your residents write a letter during your one-on-ones. You could say, hey, let's write to your wife or write to your daughter. And what do you love most about them? And so you could help them write. Drawing or painting with a friend, for a friend. Journaling, okay, there's journaling stuff. Gratitude, this is for emotional, okay. I also have a Facebook group I started, and I go live on Sunday nights at 8 o'clock. I try every Sunday night. Sometimes I have either crisis at the building or stuff with my family, but like Mother's Day. But if you want to join that Facebook group, again, I'll have it at the end. And we talked about how to be positive in the present, and gratitude is one of those things. And so having our residents be grateful, thinking about the positive things. I don't know about you, but I have seen in my building, my residents aren't dying from COVID, they're dying from being heartbroken. And I firmly believe this, that our residents, when we cut families out, many of my residents who were end of life already, that were severe stages of dementia, they gave up, they had nothing else to live for. And so helping them to continually stay connected, number one, and continually thinking about the things they're grateful for and engaging them in meaningful activities is so incredibly important right now. So here's your Bible study, easy printout, let them answer questions. And then also some exercises. So some of these are going to be more difficult, so you wouldn't want, you'd have to make sure that the exercises are appropriate for whoever you're giving them to. So that's the weekly compass. You can download these on the website. So I'll give you, it's activitydirectorresource.com. That will be on the end slide. So I'll give that to you at the end. So putting together packets, if you don't want to download those, you could have your volunteer that could download the pack or make the packets for you. Coming up with those 5 areas of wellness, a Bible study, okay, pictures. They can do these things. They're more than willing right now to help and assist. Reading stories and recording themselves, all right? Get them to read the stories for you and allow the residents to see them. Even if you set the iPad up and had them reading with one-on-ones with residents and had them, engaging with them for 15 minutes, utilize your volunteers, think outside the box, help them to think outside the box. If they record themselves doing activities, like I told you, Dementia Friendly Fort Worth, and these are free resources too. So if you look up Dementia Friendly Fort Worth, they do it every day, Monday through Friday, 10:30 to 11, all the way until September. They've got somebody doing an activity. Okay, my girls, my music therapist did a music therapy session. My activity director got on and she did a really nice painting. You get the list of supplies prior on things you might need, and then your residents can engage and watch. So if you're a adult day program, great resource. Okay, look for things like that. You can use your entertainment money differently. All right, school teachers right now are out for the summer. okay? And they might want an extra $50 that you used to spend on Elvis. You could spend it on a teacher and have them record things, education sessions, okay? Or reading, or whatever you might have that your residents are interested in. Ask the school teachers to engage with you. Teaching is going to look a lot different when this is all over with. It's going to look a lot different. And our teachers right now are thinking, how can I take advantage of this to help my community? All right, doing smaller group sizes. Like they're thinking, a lot of ours are thinking about having, 4 students in their home and just having the students pay them privately and teaching in small groups. So the world's looking at things a lot different, and they're looking for ways to reach out and connect with people. So now's our time to ask and use our resources a little bit differently. So write cards or letters. Okay, they can write cards and letters to your residents if you want. Miranda, did you have a question? She raised her hand. Okay, it's okay. I do that too. So write cards or letters so the volunteers can do that, and your residents can engage in and read them. Even writing cards to your staff. All right, we've done a lot of staff morale. I've seen on social media where activity directors are like, I'm trying to make all of these things, these positive things for my staff. Have the volunteers do that. Okay, you don't do that. Have your volunteers. So technology, that was another piece that we have changed with COVID. So CMP funds, the civil money penalty funds, are going to, I've heard that It's Never Too Late is getting $10 million to get iPads for communities. Look into this, okay? Get the form, download the form, request the tablets. Has anybody gotten any yet? If you have, type in the chat box. If you're a Medicaid, Medicare facility, you should be able to apply for them. So utilize the CMP funds. Policy on cleaning and using them. So if you're doing video conferencing, which many of us are, you can do video conferencing, but you want to make sure that you're cleaning your tablets and your devices between uses. If you will, make sure you are not using your personal cell phones or tablets, right? That is very important. I've heard many communities getting tags because they're using personal devices. There's no security even with the ones that are company owned, or you can get security. We've got a company outside that's doing our security, but it's very risky to use your own. Number one, you don't want it broken, okay, because it's not going to get replaced. It's just not good practice to be using our private things to take pictures or videos of residents. So ensure that you're not making it easy for your building and that you're encouraging your building to go ahead and purchase tablets so that you can do your job effectively. So have your policy on cleaning them. You want to sign consents for residents to be able to use video conferencing. You do not want to just do it. Okay, you need to make sure that you have communicated with the families, even if they're signing up for them. You want to make sure you have a signed consent for residents to be able to do video conferences. And then one thing we found, it was so cute. I had a family member come to me and she said, Bailey, I never thought at this age I was going to have to buy a computer, but I've had to buy a computer. And so they're learning, right? We're all learning this together. This is y'all's first webinar on Zoom. You're learning, okay? We are all in this together. And so I have a few resources Casey put together on how to use Zoom, how to download it, how to log in. So if you need that and you want to use Zoom with your families, you can print that sheet out and give it to your families in order for them to be able to engage and know how to use Zoom. So I got to tell you a funny story about my family. We did a Zoom call with my grandma for Mother's Day. We bought her pizza. My sister and her family got pizza. I got pizza and my mom and dad got pizza, and we all had a Zoom call with my grandma. And I got on about an hour early and I told her, I said, let's practice and see if you can get on. And so I had to walk her through how to get on a Zoom call. And so we all sat together and had a Mother's Day lunch with her by having pizza because it was the easiest thing to deliver to her home. And what a great experience, right? What a great memory to know that, I got to help my grandma get on and do Zoom. People are willing to learn right now. So help them learn, encourage them to learn. If you don't know how, which I'm hoping most of you do because you're on now, but if you don't know, then reach out and find somebody that can help you learn so you can teach and train others. Family visitations. I think this is the thing that has really broken my heart the most about this entire process. And I I am excited that CMS has now given guidance on how to start opening things up. We actually were looking at that earlier in our building on what family visitations are going to look like. What does it mean for compassionate visits? You know, what does imminent mean? I mean, you have to define that all for your community. You want to make sure as activity professionals that you're following the regulations very closely though, because if you have an outbreak and you've done window visits and the window's been open and now they've been exposed, it can come back on you. So ensure that even if you're doing family visitations, that your entire team, okay, you should have a COVID infection control team that either your DON or administrator put together with forms and all kinds of things that they had to turn in. If you have that team of people, ensure that you and them are communicating on what is okay. Okay, I wouldn't just do it. I would say, what is okay? I had a nurse that decided to do family visits out one of our balconies without asking permission. It does not turn out well. Okay, just don't be cautious. Okay, just be very cautious at what you're doing, and not take it upon yourself to, you know, be the hero to have these visitations, but ensure your entire team is all on the same page. I am going to ask you, and I will get on my soapbox here for a minute because I am so passionate about family visits. I honestly believe if we don't open up soon, within the next week or so, if we don't hear anything about reopening, I honestly believe that all of us should start doing a letter writing campaign. We've reached out to our leading age Texas and said, hey, we're done, right? We're done. Like, nursing homes are done. We're done being the bottom of the barrel. We were definitely vocal in the beginning on, hey, you're leaving us out with PPE, but now it's, hey, you know, our residents are dying and they're not dying from COVID. It's because you've limited our access to having families here, and families are essential. They're an essential healthcare worker to our residents' quality of life. And so start a letter writing campaign. Okay, talk to your administrator and say, hey, can we start writing letters? I'm actually going to talk to our families today and say, hey, let's start writing letters. Let's talk to our governing officials who are making all of these recommendations, and use leading age as a resource. Okay, in Texas, we use our leading age resource a lot on saying, hey, can you help us with, you know, writing these letters and these campaigns in order to make our voices heard. We're the ones taking care of our seniors, okay, and we're doing a good job, right? There's so many of us that are doing good. It's hard whenever there's a few that aren't following infection control policies. They're making it hard for the rest of us. And so start that letter writing campaign and help your team stay safe. Okay, help your team understand what safety looks like, what PPE you need to wear, how you need to clean. Ensure that you take charge of your department to keep it safe. That's what you have to take control over. So advocate. We've got to advocate. I hate that we're taking steps backwards. We're so far, right? And making sure that seniors had quality of life, and we're moving to being more independent and person directed. And now COVID has felt like it's just taken a ton of steps back on, you know, more regulations on top of us. So have your voices heard. I encourage you to have your voices heard. Let's talk a little bit about day programs. So if you are closed, if you're a day program, will you comment and say if you're closed or open? I would love to know. So closure of your day program. So ours closed. If you're still open, that's awesome. You know, make sure you're doing the small groups, you know, no more than 8 to 10, whatever your policies are. And then virtual activities. Okay, you can still do virtual activities with them. I encouraged ours to stay connected, call out. I've had families calling on a daily basis saying, hey, my loved one's declining because they're not coming to your day program. They're not coming and they're declining. And how do I keep them from declining? And I actually have done a couple of YouTube videos specifically for families that have their loved ones at home, that have home health, or you know, how to keep them engaged, how to prevent them from falling, because we started seeing that they were struggling. Okay, our families of our day program participants are struggling, the opposite of what our long-term care families are. They're missing their loved ones, and our day program families are saying, oh my gosh, I need help, right? Please help me. And so support them through education. Okay, educate them, give them the resources. Say, hey, I'm going to send you out these packets. Okay, download the weekly compass and say, hey, I want you, to take this and engage with your loved one. I actually have a video on how to use the weekly compass, so they can watch that as well, on how to upgrade and downgrade and use the weekly compass for all different levels of care. So send those packets, having one-on-one conversations. It's okay for you to call the family and say, hey, can I talk to your loved one for a while? Do 15-minute one-on-ones with them. So if you're day program is closed, you can still get creative in taking care of your participants. Okay, because when you open back up, you want them to want to come back to you. You want to have them come and join you again. It looks like many of you are reopening. Good. We opened back up. Excellent. Yeah, you were closed for several weeks. Good. Yeah, so we're opening back up in small. We're doing a whole study right now on how our day program is going to look very different, right? Everything's going to look different, but how are we going to make it look different and still have resident rights? Okay, we still need to have resident rights. So here is the links to get resources. So you want to stay connected. Right now is the time to get on social media and stay connected. All right, people are giving out stuff. They're, educating and talking. Now's the time to stay connected. And so I do have a Facebook group. I actually started it for just activity professionals. It was Activity Director Resource. Some of you have probably already joined from when we were at conference. If you haven't joined, it's now Senior Living Professionals Resource. Okay, so you can search that group. If you can't find it, email me, but that's the group. I do go live on Sundays at 8. I have been really leaning toward talking about being positive. I try to stay away from all the COVID talk. There's so much of it right now. But how can we be positive in the present? I talk about leadership, any problems or concerns. One day I just did answers and questions, or questions and answers with the group. So join the group. I opened it up to everyone because I had a lot of activity professionals emailing saying, hey, can I get my MDS coordinator, or my friend's a nurse and she's not activities, and can she join our group? So I opened it to everybody because I think right now is the time where we can break down the silos. Okay, we should not be working only in our activity department. We should be really working closely with nursing. We should be working closely with dietary. In our building, we've seen a ton of weight loss. Again, I think it's very directly connected to our residents might not understand COVID or know that we're closed down, but they feel it. Okay, they feel the difference. We're all walking around in masks. It's way different. We actually went to paper plates. Oh my goodness. Okay, they don't eat off paper plates. Like, we had a significant decrease in intake because of the paper plates. You have to investigate that quickly. So I opened it up to everybody because we just cannot work in our silos any longer. We can't. We have to work together. And so I want everybody to have access to resources. It really is led by me. I try to keep all of the negative stuff out. We can have good discussions, but no negativity in the group. And so I hope that it would be a safe place for you to feel comfortable to be a part of. I also have my YouTube channel that I am really working. These are a few YouTube clips that I have done recently. So you want to subscribe. If you just do a Google search of Bailey Hillman YouTube, it should pop up some YouTube videos. You will be getting a link. I'm going to put this. It's the easiest way to do this is put this on our YouTube page, and then we'll send you out a link so you'll be able to subscribe. You can use these for your families. Okay, again, all free resources. A ton of people have free resources that I would encourage you to reach out and get. So here is my website, baileyhillman.com. You can also go to activitydirectorresource.com. That is the website that you're going to get all of those downloaded resources. So if you go to the shopping area and the what's new area, you'll be able to download a lot of resources. Here is also a document that is on the website. It's a well-being document. You can use this as a tool to help your assistants or even you keep track of how am I meeting my residents' areas of wellness. Okay, it looks at all the areas of wellness. You can put ideas in here on each resident. Okay, so put their name here and say, okay, for physical, they like to do, exercise, or they like to play basketball. If you bring in a hoop in there and let them shoot the basketball a few times. For cognitive, they like this trivia. Here's their like. So you can fill this out for each resident in order for your team to have a quick reference on how to engage them. Okay. You also want to include it in your care plan, but this would be a good tool for you to ensure you're meeting every area of wellness. So that's the website here. And then here is my email. So bh@baileyhillman.com. So bh@baileyhillman.com. So if you have any questions, all right, I know it sounds like I'm very busy, but I am passionate about helping you. I am very passionate about ensuring that you all have the resources that you need in order to do your job very well. And so I'm excited to be a part of Leading Age Oklahoma. I am very honored to be with you and to share, tips and tricks. I know many of us have had a lot of changes during this time, but I hope that this was encouraging to you to know that our new normal is going to be okay. All right. We're all going to be okay. I tell my staff and families, you know what? We're going to be okay. We deal with flu. Okay. Just real quick. We deal with flu. Okay. When a flu season hits, we deal with the flu. We know the processes and things with that. We wear a mask if they don't get the shot. COVID the same way. We're waiting on the immunization, but you know what? We're going to make it through that. If you had a scabies outbreak or any other type of communicable diseases in your building, we know how to respond. COVID is the same way. All right. It's the same way. And so just know that you're going to survive this. We're all going to survive this together. So I hope that today was helpful. This is the giveaway. So I have a girl that was an activity assistant, and her family do shirts and masks and all kinds of things. So this is the prize. It has Activities Strong on the side of it, or if you're not an activity professional and you've joined and you get it, I will put whatever you want on the side of your mask. But I hope y'all have all enjoyed the presentation. If you have any questions, please type them in the chat box and we can stay on. If you got to go, I understand it is 2 o'clock. So if you have to go, no worries. But if you want and have questions, let me know. Thank y'all. Y'all are so nice. Glad y'all like the prize. I thought y'all would. I wore it today. I was the Vanna White for it today, so. All right, any questions? I actually started activity director at a rural hospital. Yes. Absolutely. So is it Trask? That is a cool name. If you want to email me, so bh@baileyholman.com, and let's talk about hospital changes. That's great. Yeah, I've got a lot of great ideas there too. So glad y'all enjoyed it. Yes. Hi, Lisa.
Can I speak for just a minute? First of all, for those of you who weren't on the call before it started, I'm Lisa Hill with Leading Age Oklahoma, and we are just so grateful to have had you come on here, Bailey. The information was incredible, as you can see in the chat box. Everybody has loved what you had to say, and we greatly appreciate it. Also, just want to let all of the participants know that I will be following up with an email. It might be on Monday, but I'll follow up with an email, and I'll include not only your website and where they can get these resources, but also we had talked about the use of this CMP funds for iPads. Yeah. And we did a whole write-up on that. Mary does a COVID-19 update 2 or 3 times a week for all of our members. And we had a whole write-up about that. So I will include the information about that as well for those that may be interested in it. And then possible recordings and things like that. So yes, anything that you have that you would like us to include, Bailey, just send it to me and I'll get it out to all of our participants. And I thank each and every one of you for being on here. And I'm going to back out now and let you get back to your questions. But I just wanted to let everybody know they keep asking for the information and it's going to come to them next week. Good. Yes. Thanks. Good. Tons of information. I'm telling you, you guys are blessed to have Leading Age. I feel the same way about our Leading Age. It's a great resource to have. So I'm glad y'all were all able to participate today. And looks like we don't have many questions. If y'all have personal questions that you would like to ask or things about your building or specific residents, feel free. Like I said, I might seem busy, but I love helping. So if you need anything, you reach out and we'll be in communication soon. Thank y'all for joining. Have a great day. If you'll go on the website, you can get the mask there. And I'll send the link in the resources that Lisa sends out. Good question. Absolutely.